Hi, my name is Jamie. I am going to be administering Millie Larson's medications per our medication administration record. I am first assessing the medications. Medications ordered are the Docosate 100 milligram oral tablet and haloperidol 2 milligram IM and ciprofloxacin 200 milligram per 50 ml 0.9% sodium chloride IV piggyback to run over 30 minutes with a drop factor of 15 drops per ml, using a mini bag for setup with primary and secondary tubing. I am going to check the patient's allergies to the medications. According to RMR, the patient has no known allergies. Next, I'm going to sanitize my hands. I have gathered my supplies to administer these medications. I have a pill cup, a 3 cc syringe, a 1-inch 23 gauge needle, alcohol prep pads, clean gloves, tape, and a 2x2 gauze sponge. All right. I'm going to be checking the medication packaging against the MAR. I'm also going to be checking the expiration date on the medication. Docosate sodium is a 50 milligram tablet. We have 100 milligrams ordered, so the patient will be getting 2. And the haloperidol is a 5 milligram per ml vial. Expiration date is good. The order is for 2 milligrams IM. We will be administering 0.4 mLs. I am going to be placing the oral medications into the medication cup right here. And then for the IM, I am going to be opening this. There we go. And I'm going to be cleaning the top of the vial with my alcohol wipe. Get rid of that. I am going to be attaching my needle to the syringe. We need 0.4. I'm going to hold the bottle, put the needle in, put the air into the vial, and pull back until we have 0.4. Pull down, tap out any air, and then push up to expel any air from the syringe. We're going to safely recap the needle, and then I am going to be labeling with tape so that we know what is in the syringe. Once the syringe now has the medication in it, it still needs to be labeled. All right. The next thing I am going to do is make sure I provide privacy to my patient and ensure that they are in a comfortable position before administering their medication. I next have to identify my patient. The patient has an armband on. I am comparing the patient's name and date of birth. Patient name is Millie Larson. Date of birth, January 1st, 1936, and this matches my ID band, so I can continue. I'm explaining the procedure to my patient. We're going to be administering Docosate for a stool softener. You're going to take that by mouth with a little bit of water, and then we are going to be doing an IM injection towards your hip area, and this will help with agitation. I will answer any patients at this point any questions the patient may have. To administer the oral medication, I'm going to place the medication into the patient's hand and let them take the medication on their own. If for some reason she's unable to do that, I can assist her to take the medication cup to her mouth, pouring the medication under the tongue and providing some water to assist in swallowing. To inject the IM medication that we have in the syringe, let me move my arm out of the way here. I have a grapefruit ready. We are going to be using this for my injection. In order to identify the correct site, we're using the ventrogluteal site. I'm going to identify the site by having my patient lie on her side with her legs straight, and then locating the trochanter, the anterior superior iliac spine, the iliac crest, which obviously on grapefruit is not very easy to identify. Next, I'm going to take and place my palm on top of the greater trochanter. My pointer finger is going to be pointing toward the anterior iliac spine, and the middle finger toward the iliac crest, because this is going to create a triangle. I'm not sure if you can see that here. And the area between my fingers is going to be our injection site. So we have identified our site for injection, and I'm going to next put on my gloves. I have clean gloves here. And I've sanitized my hands. I am next going to take an alcohol wipe to clean the area, starting in the center and moving in an outward circular motion from the area that we identified. And we are going to dispose of this in the trash. We're going to allow the alcohol to dry before continuing with the injection. We have the syringe here. It is labeled with the medication name, the haloperidol, 2 milligram. Again, it's 0.04 mLs. I should have left the alcohol wipe on there pointing to the area to identify, which was right here. I did not do that. I'm going to remove the cap to the needle. I'm going to pull the skin taut between my fingers. At a 90-degree angle, we are going to inject the syringe. We are going to aspirate the needle for about 3 to 5 seconds. Make sure there's no blood return. There is no blood return, so I can continue with the procedure. I am going to inject the medication by pushing down on the plunger. I'm going to remove the needle and engage the safety. Safety has been engaged. I will now dispose of this in my sharps container. And then I can remove my gloves and put these in the trash. I'm going to wash my hands. I'm going to make sure my patient is comfortable. I did forget to apply a bandage, so we will put that on the injection site and cover it with tape. hold it in place. My patient is insisting they are safe and comfortable. They have their call light in reach. The bed is in the low position. I am going to now leave the room, and I am going to document that the medication was given on the MAR by writing my initials and the location of the IM injection.